President and owner of Core Risk Services Incorporated, Kelley Woodfin has an extensive and accomplished background as a registered nurse, is licensed in the states of California and Utah, and is well respected for her knowledge, skills, and experience as a professional risk manager. In her role as president, owner, and principal consultant, she provides client-focused, enterprise-wide risk management services with the primary goal of preventing financial and human resource loss from whatever cause, developing and implementing enterprise-wide risk management programs, and providing loss prevention and control strategies for clients, mentoring their managers and line staff in the use of critical thinking skills and situation monitoring and awareness, and incorporating quality improvement and compliance. There is not a time that Kelley can recall where she wasn't involved in healthcare in some manner, starting at the tender age of 18 months. At that time, she was living with her parents and older sister in Pensacola, Florida, where she contracted poliomyelitis with her young father, a naval officer who died from the illness within 2 days of admission to the Naval Hospital. In her recovery process, Kelley had a long stay at the Naval Hospital with another long term of physical therapy. She always remembered the nurses who helped her during her illness, and she began to understand that their love, compassion, and skills helped her to recover. Throughout her childhood, she deeply desired to follow in these nurses' footsteps. That early aspiration to become a nurse led her to apply and be selected to the nursing program at Los Angeles County Medical Center School of Nursing, graduating with honors and becoming licensed as an RN in California, where she began her career in pediatric intensive care at the hospital. Within a year of receiving her nursing license, Kelley transitioned into emergency services at a local community hospital, where during her 8 years of employment she was increasingly promoted, beginning as a staff nurse and then becoming a paramedic liaison nurse, department supervisor, department director, and clinical emergency nurse specialist. As the PLN, Kelley developed and implemented the first California paramedic base station. While at the first hospital, Kelley became a certified emergency nurse, a certified advanced life support provider, and was the 5th mobile intensive care nurse in the state of California. Later, as an RN in the emergency department at a large Southern California hospital, she developed and implemented their paramedic base station as well, serving as both paramedic liaison nurse and emergency services clinical educator. Kelley has also had experience as a flight nurse, assistant administrator, and flight coordinator for Life Flight Southern California, where she educated the flight nurses and developed the fixed wing transport program. During her tenure in emergency services, Kelley was honored to be elected president of the California Emergency Nurses Association, to work with the California Nurses Association to develop the first statewide education program for mobile intensive care nurses, and to serve on the California Governor's Earthquake Task Force, developing their response protocol and the structure for field medical services. She later provided consultation in emergency management in emergency departments across the country as the Director of Nursing Services for an organization that contracted physicians for placement in emergency departments across the nation. Later, she became Utilization Manager for FHP in one of their network offices, and then assumed the position of Associate Director of Nursing for the FHP staff model. When an opportunity to serve as staff model risk management opened, Kelley accepted the position and was later promoted to Director of Risk Management for FHP's private network of 950,000 lives, working closely with FHP's legal department to prevent, mitigate, and control loss. Kelley earned a Bachelor of Science in Business Administration with honors at the University of Phoenix, served as president of the Southern California Association of Healthcare Risk Management, became a certified professional in healthcare risk management, and later earned a designation as a distinguished fellow of the American Society for Healthcare Risk Management. She also received the Lifetime Achievement Award for contributions to the risk management profession from the Southern California Association for Healthcare Risk Management. Kelley served as the Director of Risk Management and Acting Staff Model Director of Nursing for a mid-size HMO in Long Beach, after which she was hired by Aon Risk Consultants Incorporated to provide risk management consultation to 4 California long-term care companies, ultimately being hired by one of them to serve in the role of Vice President of Risk Management Consulting. In that role, she was responsible for market risk management consulting services and subsequently contracted with 9 other long-term care companies to provide risk management consulting for each. When she moved to the state of Utah 5 years later, she continued to provide services to her employer and then formed and incorporated Core Risk Services Incorporated, for which she has served as president, owner, and principal consultant since 2009. In this role, Kelley continues to develop and implement risk management and quality improvement programs, assist clients with their compliance and ethics programs, provide loss prevention education for client staff members, and promote just culture and high reliability in care and services. She works with insurers, attorneys, C-suite leaders, medical directors, skilled nursing directors, and long-term care managers to reduce and manage unexpected outcomes and claims, and to manage litigation and defense strategy. In her role, she also performs alternate dispute resolution with an excellent track record for positive resolutions of pre-litigated claims. As a representative of the California Emergency Nurses Association, Kelley was also honored in the past to serve for 5 years as a commissioner of the Los Angeles County Commission Committee on Emergency Medical Services, making numerous positive recommendations and motions for improvement of field care and transport, among other challenges to emergency services at that time. In addition, she has authored articles on emergency nursing, chapters in several textbooks, co-authoring a book entitled Emergency Preparedness for Healthcare Facilities, and participated on editorial boards of professional journals, including the Journal of Healthcare Risk Management by the American Society for Healthcare Risk Management, and was editor of an issue for another professional journal. Kelley is recognized and well respected as a provider of lectures on emergency nursing, disaster planning for both healthcare organizations and businesses, nursing case management, critical care nursing, paramedic services, and risk management for over 5,000 professionals, including paramedics, nursing students, licensed nurses, medical students, business students, physicians, administrators, case management, and risk managers across the United States and in Canada. Her current affiliations include the South Valley Utah Chamber of Commerce, the Utah Better Business Bureau, the Utah Association for Healthcare Risk Management, the Southern California Association for Healthcare Risk Management, and the American Society for Healthcare Risk Management. She has served for the past 11 years as a volunteer RN in the Utah Medical Reserve Corps, a disaster relief organization funded by the Federal Emergency Management Agency and operated by the Utah Department of Health Services. Kelley looks forward to continuing her work as a professional risk manager and consultant for many years to come. Her advice to younger healthcare professionals is, always do the right thing the first time. Aspire to continuously improve your knowledge and skills and follow your heart regardless of the challenges involved. She adds, it is vitally important to do what you were born to do and to do it as well as you possibly can, keeping a positive attitude and a good sense of humor. She hopes to be remembered as a dedicated, compassionate, intelligent, and highly skilled professional, as well as a caring, adventurous, and fun-loving woman. She is blessed to have a loving, supportive family that includes her 2 daughters and their husbands and children, her 3 sisters, and several nieces and nephews with whom she loves to share her experiences, knowledge, wisdom, and laughter. As she says, "I always seek to find the funny in every circumstance, no matter how good or how bad it might be, because without doing so, life can have significant ups and downs. Humor gets you through it."